In this video, we will discuss machinery or continuous murmur, Gallavardin murmur, and memory Soufflé. So let's discuss a continuous or machinery murmur. Machinery murmur is heard in patent ductus arteriosus, and it results from an abnormal flow of blood from the aorta to the pulmonary artery, a connection distal to the subclavian artery, producing a continuous machinery murmur in the left sternal border that starts in the systole and peaks at the second heart sound and continues in the diastole. The ductus arteriosus in the fetus connects the pulmonary artery to the descending aorta. It allows blood from right ventricle to bypass the fetal lung. At birth, it closes and becomes ligamentum arteriosum. What's the effect of increased pulmonary arterial pressure on machinery murmur? Machinery murmur is present in PDA until pulmonary arterial pressure is lower than the aorta. When pulmonary hypertension occurs, the diastolic portion of the murmur disappears and only systolic murmur remains. What's the result of shunt reversal? When left to right shunt reverses and becomes right to left shunt, that causes cyanosis in the toenail, not in the upper limb or in the fingernails. This is known as differential cyanosis. And why does it occur? Because the connection between the pulmonary artery and the descending aorta is after the subclavian artery. So the deoxygenated blood goes to the lower limb, causing cyanosis in the toenails, not in the fingernails. An innocent cervical venous hum over the right supraclavicular fossa may be misdiagnosed as PDA due to its continuous sound that is louder in diastole. It may be abolished by pressure over the ipsilateral internal jugular vein. And number 3, a venous hum below the clavicle may also be misdiagnosed as PDA. And the murmur of coarctation of aorta may also be continuous that radiates to the back and is best heard at the interscapular space on the back. Now, Gallavardin phenomena. Aortic stenotic murmur disappears from the right second intercostal space and appears at the apex beat area in the left fifth intercostal space, mimicking mitral regurgitation murmur. This is Gallavardin phenomena. Memory Soufflé. It is an innocent systolic or continuous murmur that occurs over the breast during the late pregnancy and early postpartum period.